Thanks so much for joining us for today's Alien Emergency Medical Process Training. Throughout our training today, we'll refer to Alien Emergency Medical as AEM. We understand that the last year or so has been challenging when it comes to processing applications for the AEM program, and we appreciate your dedication to serving patients receiving emergency care. Your continued participation and feedback has been invaluable as staff at HCA have been working diligently not only to catch up on the backlog of these applications, but find ways to improve the process that we are excited to share with you today. AEM can be a complex program, and we hope that today's training will improve your overall experience when working with AEM applications. We look forward to your feedback over the coming months. Today's training supersedes the AEM Process training shared in March of 2014. This training is designated for community partners who assist individuals with applying for and submitting medical documentation for the Apple Health Alien Emergency Medical Program. Just a reminder that today's presentation will be recorded. Both the recording of the webinar and the presentation slides will be added soon to the Training and Education webpage, which we'll share with you at the end of our webinar. Let's get started. AEM is a program for individuals who do not meet citizenship or immigration status requirements, or for qualified individuals who have not met the 5-year bar and have a qualifying medical emergency. Those applying for coverage due to a pregnancy-related hospitalization should apply for Apple Health for pregnant women coverage and not for the AEM program. To qualify for AEM, an individual must have or need at least one of the following: a qualifying emergent medical condition such as emergency room care, inpatient hospital admission, or outpatient hospital surgery, a cancer treatment plan, dialysis treatment, anti-rejection medication for an organ transplant, or long-term care services. Long-term care is a program with limited availability and must receive prior approval by the ALTSA program manager. Contact Sandy Robertson for more information. Both DSHS and Healthcare Authority receive and process AEM applications. DSHS processes applications for AEM under Classic Medicaid, which includes Apple Health long-term care and aged, blind, or disabled coverage. The Healthcare Authority manages eligibility determinations for AEM under MAGI Medicaid, which includes Apple Health for adults, children, family, and pregnancy coverage. DSHS processes AEM applications under Classic Medicaid when an individual is age 65 or older and is not a caretaker for a child under the age of 19, or the individual is receiving long-term care services and is not relatable to a MAGI program, or when the individual is receiving Medicare, which is not common for this population. Applications should be submitted through Washington Connection at www.washingtonconnection.org or by completing an application for long-term care or aged, blind, disabled coverage, which is the HCA Form 18-005. To submit a Classic Medicaid application online for AEM, the following steps are required. First, submit the AEM application at Washington Connection, www.washingtonconnection.org, www.washingtonconnection.org. Next, fax all supporting medical documents for Classic Medicaid to 1-888-338-7410. We will discuss required supporting medical documents at length in upcoming slides. To submit a paper application for AEM for Classic Medicaid, we require the following steps are taken. Write AEM on the top of the application. Write the date coverage needs to begin. Include applicable supporting medical documents, which we'll discuss at length in the next section, and fax the completed paper application, the HCA 18-005, and supporting medical documents to 1-888-338-7410. The Healthcare Authority processes AEM applications under MAGI Medicaid. For the Apple Health for Adults program, the individual must be age 19 up to 64, must not receive Medicare, and must follow MAGI rules established through the Washington Health Plan Finder. The Healthcare Authority requests that applications for AEM be submitted via paper application using the following form. The application for healthcare coverage, HCA Form 18-001P, at the link shown on this screen. To submit a paper application for AEM for MAGI Medicaid, we require the following steps are taken. Write AEM on the top of the application. Write the date coverage needs to begin. Include applicable supporting medical documents, which we'll discuss at length in the next section, and fax the completed paper application and supporting medical documents to 1-866-841-2267. Now that we've reviewed how to apply for AEM coverage for both Classic and MAGI Medicaid programs, let's review a very important additional requirement. To determine clinical eligibility for AEM, supporting medical documents are required. Whether applying online for Classic Medicaid or by paper application for both Classic and MAGI Medicaid, it is vital that supporting medical documents are submitted at the time of application. The next 6 slides provide a description of the required supporting medical documents based on each particular emergent condition required to determine clinical eligibility for AEM coverage. If the individual received emergency room care, please provide the following medical documents. A. Emergency room treatment page, and B. Copy of completed hospital claim form, also known as the UB04. If the individual received outpatient surgery care, please provide the following medical documents. The operative note, description of procedure completed, and copy of completed hospital claim form, also known as the UB04. If the individual was admitted and received inpatient care, please provide the following medical documents: history and physical, the hospital discharge summary, and a copy of completed hospital claim form, also known as the UB04. If the individual is in need of cancer treatment, please provide the following medical documents: current cancer treatment plan from the attending physician, and the pathology report, if one is available. If the individual is in need of dialysis treatment, please provide the following medical documents: current dialysis flowcharts from the dialysis center, or treatment plan from the attending physician. If the individual is in need of anti-rejection medication for a post-organ transplant, please provide the following medical documents: treatment plan from the attending physician or provider, including required medications. Write the following information on the supporting medical documents before submitting them to HCA or DSHS. AEM at the top of each document sent, name of client, use the same name as on the application, date of birth, and the ACE's client ID number if it is known. The client ID number is not required, but it is very helpful. Please note, if you do not have the ACE's or DSHS client ID number, please move forward with submitting the application and supporting medical documents. Again, the client ID number is not required. If available, please submit documents necessary to determine eligibility along with the paper application and supporting medical documents. Please note, submission of these additional documents should not delay the return of the paper application and supporting medical documents. If they are not available, please move forward with submitting the application and medical information. To expedite the eligibility determination process, please submit the following information. For immigration documents, for those who are lawfully present, provide verification of immigration status. For lawfully present individuals only, for the applicant. This could include a lawful permanent resident card, also referred to commonly as an LPR or green card, an I-94, an immigrant visa, or an employment authorization card. Again, please note that lack of this documentation should not delay the return of the paper application or supporting medical documents. The required supporting medical documents should be submitted at the time of application to, for Classic Medicaid, fax to 1-888-338-7410, and for MAGI Medicaid, fax to 1-866-841-2267. Once the application and required documents are received, they will be sent to the HCA Clinical Consultant for a decision as to whether or not the condition meets the criteria for the AEM program. If additional clinical information is needed to make a decision, the referral coordinator or provider's office will be contacted via phone, and a letter will be sent via fax requesting the clinical documentation. If the required documents are not received within 10 days, the application will be denied. It can take up to 15 days for the HCA Clinical Consultant to make a decision. Once the HCA Clinical Consultant makes a final decision, the HCA Medical Assistance Specialist or DSHS Financial Services Specialist will approve or deny the AEM application according to the clinical consultant's decision. Eligibility will be reconsidered if the individual provides any missing verification within 30 days of the date of denial. We encourage that you check ProviderOne before you request an AEM status update. To obtain a status update or ask questions about a classic Medicaid AEM case, please call DSHS Customer Service Support Center at 1-877-501-2233. Emergent requests will be directed by the CSCC to the AEM team for follow-up with the client or authorized representative. We are well aware that the prior AEM process was very lengthy and frustrating for HCA staff, providers, and those applying for AEM coverage. In January 2015, HCA met internally to begin the process of improving and streamlining the AEM program. Some of the changes being implemented include system enhancements, improved correspondence, and a restructured process of receiving applications via fax. We are very happy to announce that AEM processing timeframes have shown a significant decrease since May of 2015. Now that we are caught up, we strongly request that before you send an email for an AEM status update, please be sure to check ProviderOne for AEM coverage. For necessary MAGI Medicaid AEM status updates or questions, you may use the AEM email address medsae@hca.wa.gov, which replaces the Ask MAGI web portal. This should only be used for status updates on AEM applications submitted more than 45 days ago. Recent requests sent via the Ask MAGI web portal do not need to be resubmitted and will be processed in the date order that they were received. Please note, HCA will not be responding to any non-emergent status checks that are received in the AEM mailbox that are within 45 days of the receipt of the application. This time is needed to allow staff to focus on application processing. Again, now that we are caught up, we strongly request that before you send an email for an AEM status update, please be sure to check ProviderOne for AEM coverage and try to limit updates for urgent cases. When using the new AEM email address for MAGI Medicaid inquiries, please include the following. In the subject line, AEM status update or question. Submit a separate request for each individual or patient. Include the following information: the client name, the client date of birth, the ACE's client ID number, or the Health Plan Finder application ID number. Also include your request for your status update or your question. Only emergent issues should be directed to the HCA AEM contact person. This includes emergent issues for an individual with an ongoing medical condition who is unable to receive medical treatment or obtain medications. The HCA AEM contact is Kent Feaster at 360-725-9566. Before we wrap up our AEM training, let's review one last important topic. There have been a lot of questions regarding the designation of an authorized representative, most commonly referred to as an AREP, and the use of the authorization and consent forms. Only a client can initiate and request another individual to be an authorized representative to act on their behalf, receive client notifications, and discuss eligibility. An individual can designate an authorized representative or AREP by completing any one of the following: the joint DSHS HCA Agency AREP form, or the DSHS 14-532, the AREP section of the application for healthcare coverage for MAGI Medicaid, the HCA 18-001, or the AREP section of the application for long-term care, aged, blind, or disabled coverage, also known as Classic Medicaid. An AREP must be designated on an HCA or DSHS form. Authorization and consent forms are typically used for public disclosure and the sharing of confidential information between specified parties. These forms are not used to designate an AREP. This screen shares an example of the joint DSHS HCA Authorized Representative Form. This is the DSHS Form 14-532. This form can be found on the DSHS Forms website at the link shown on this screen. This screen shares an example of the Authorized Representative section listed on the application for healthcare coverage for MAGI Medicaid. This section is found on the HCA Form 18-001P. This form can be found on the HCA Forms website at the link shown on this screen. This screen shares an example of the Authorized Representative section listed on the application for long-term care and aged, blind, or disabled coverage for Classic Medicaid. This section is found on HCA Form 18-005. This form can be found on the HCA Forms website at the link shown on this screen. We'd like to end our presentation today by leaving you with some additional Apple Health Medicaid resources, including Apple Health Medicaid. This page shares how to apply for Apple Health, renew coverage, and select an Apple Health Managed Care Plan in Health Plan Finder. Training and Education page. This page provides our HCA Community Partners with helpful enrollment guides, training, webinars, and outreach materials. Today's recorded AEM presentation and presentation slides will be added soon to the Training and Education webpage under Webinars, Videos, and Media Presentations. You'll find listed on this screen the links to both the HCA area representatives and a cross-agency customer service center referrals desk aid. Finally, general questions regarding the Apple Health Medicaid application and renewal process can be directed to Medicaid Expansion at hca.wa.gov. As we wrap up our training today on the AEM process, we'd like to reiterate that this program is a two-part process. 1, the determination of financial eligibility, and Part 2, the clinical determination of a qualifying medical emergency. The AEM program will continue to be a lengthier process than other Apple Health programs. We'd like to thank you for your continued partnership and ongoing valuable input in identifying areas for improvement. Now we ask that you stay on the line to join us for a question and answer session.
Question number 1. Are outpatient surgeries covered when scheduled, or do they have to be immediately following an ER visit?
They must be admitted through the ER for surgery. It must be done during that admit. Scheduled outpatient or scheduled procedures done through a clinical office are not covered.
Okay, question number 2. When a person enters the United States as a parolee and becomes pregnant, is that person eligible to receive pregnancy medical without it affecting them in their near future to fix their legal status in the U.S.?
Eligibility is based on their current immigration status and whether or not they meet residency requirements.
If this program is for alien candidates, why do you require I-94 or green card?
We only require I-94 or their green cards if they are qualified or non-qualified aliens. If they are not lawfully present, they would not have those cards, and they are still potentially eligible for the Alien Emergency Medical Program.
If a patient is admitted to the hospital, for example, for chest pain, and all tests done show that the patient is normal, is this individual eligible for AEM when it is clear it is not an emergent condition?
All chest pain going through the ER must be considered an emergent condition at the time. They must rule out a cardiac event at the ER. So yes, this is covered, usually.
What is the current time frame for paper applications to be entered into the health plan finder for MAGI Medicaid and or for the case to be referred to a consultant?
At this time, it's less than 2 years.
How do you suggest that we search for an AEM status update in ProviderOne when we may not have a Social Security number?
Possibly you would want to contact either the authorization unit or the medical unit to see if we have the client's description under what we call a dummy number.
Also, would they not have been issued a ProviderOne number as well?
Not always.
Not necessarily.
My suggestion would be to send them to or contact the MAX line, which is the 1-800-562-3022, and they can help you find out whether the client's eligible.
Okay. Where should the AREP form be sent to? Would we fax it to HCA or DSHS? And I think the answer to that would be if you're completing an application for AEM for MAGI Medicaid, then it would be fax it to the fax number that we've shared for MAGI Medicaid. And if you're doing a classic Medicaid application, then you would fax it along with those documents to DSHS. If a client's date of service is June 10th, and they are approved for AEM effective June 10th through June 30th, does that mean that any date of service between 6/16 and 6/30 are eligible for coverage?
No, I think that would depend on the program that they were approved for, and it would also depend on whether or not the treatment being provided is related to what they were clinically approved for.
Can you please give me additional information on AEM coverage for long-term care, such as nursing homes? And I think we have to recommend that you make contact with the ALTA program manager if you have any questions, and that address was included in the webinar. Do you have anything to add, Lori?
I do. The long-term care program is actually a state-funded program. It's not federally matched. We are limited to 45 slots, and it's for long-term care in a nursing home, in-home, or assisted adult family home, assisted living placement. And because we only have 45 slots, it has to be pre-approved by Sandy Robertson, who was listed on the slide. She is the one that takes a look and sees if there's a slot available and pre-approved. I will say that the slots are always full, and there is a waiting list for individuals that are currently in hospitals to get into that program. So it's very, very limited, and it is a state-funded program.
Do you have to be undocumented to be approved under AEM? Or can they be in the process of their 5-year waiting period?
An individual does not have to be undocumented to be approved for AEM. Anyone who has not met the 5-year bar or is not exempt from the 5-year bar is potentially eligible for AEM if they have a qualifying medical emergency. If they are a pregnant woman or a child, they'd be covered under the state-funded Pregnant Women and Children, or if they are lawfully pregnant, they would be covered under the federally funded Children's and Pregnant Women program.
Typically, will follow-up treatment after an inpatient visit be covered?
No. There's no coverage for follow-up after hospitalization. All services must be obtained inpatient. Anything outside of the hospital is not covered, except for one exception. When a patient is discharged from the hospital and they must get training at home for certain types of treatment, such as wound care, they are allowed 2 home health visits only. Other than that, their medications must be discharged with them, and their follow-up visits must be done under a different way.
How many times can a client get AEM in the course of a year?
There is no limit as long as they have a qualifying condition.
Why is a paper application recommended when an online application through Washington Connection has already been submitted? So I think we need somebody to explain the difference between classic and...
For MAGI Medicaid AEM programs, we request a paper application because most of our clients do not have Social Security numbers, which creates a duplicate client ID in the ACE system. For classic Medicaid, I believe applying online is still possible.
If a dialysis patient has a permanent resident card and has waited their 5 years, will their coverage change and pay for a kidney transplant?
I do believe that it depends on what their coverage is after they have met their 5-year bar. Some plans, I suppose, do pay for an organ transplant and others do not. It depends on their coverage.
But just to be clear that the AEM program does not pay for transplant.
And I would like to add, if they have met their 5-year bar, they would no longer be on the AEM program. So as was just said, it would then depend on their plan whether or not the transplant was paid for.
What will get an application processed faster? Submitting just the application and any ID available, then faxing the UB04 and medical records once available, or do you recommend faxing all documents at once?
We recommend faxing all documents at once. We would like to receive the supporting medical documents with the application.
Do people on visitor visas or student visas always qualify for AEM?
No. The particular visa doesn't really matter. If they are on a student or visitor visa, they are lawfully present. So if they're a pregnant woman or a child, they would be under another program. If they have a qualifying emergency and they meet residency requirements, they would be potentially covered under the AEM Emergency Medical Program.
Can you again cover the process for AEM, the difference between MAGI and Classic, or is it the same group? I keep having DSHS tell me that the Classic AEM application is pending with HCA AEM. I'm thinking it's probably the difference between eligibility versus the clinical, probably waiting for the clinical decision. So the application would be getting processed through DSHS, but when they're telling you that, they probably are waiting for the HCA clinical determination. Okay, what is the expected response time when we email the medaem@hca.wa.gov for a status check?
So, following the rules that we've asked everyone to follow, it would depend on what the issue was for the response time. It depends on if it's an urgent case. We would respond rapidly. If it's a status check and the case has not been submitted for over 45 days, then that would be prioritized lower. If it's a status check that's over 45 days, then that would be prioritized higher. But at this time, I can't place a specific day number on it because the amount of emails that we receive varies from day to day.
Does AEM cover durable medical equipment for patients such as wheelchairs or hoisters?
No, it does not.
What is the criteria, or can an AEM application be expedited?
AEM applications can be expedited for clients with ongoing conditions or access to care issues.
So are you trying to say that there are two different programs, one for under age 65 and one for over age 65?
Yeah, just like with all Medicaid programs, the classic Medicaid is for individuals who are over the age of 65, and MAGI Medical is for anyone under 65.
Is there anywhere online that we can go to find out what exactly is covered under AEM? We work with providers that refer patients to apply for AEM.
They can refer to the WAC, which is
182-507-0115, and then also 182-507-0120, and 182-507-1025. Sorry, 0125.
How do you expedite application with a qualifying medical condition such as cancer or dialysis treatment?
Either sending an email to the MAGI AEM inbox or calling Kent Easter would be a way to expedite access to care issues.
Now we're receiving a lot of questions regarding when will the webinar be available online, and that should be in about 7 to 10 days. It'll be on our training and education webpage. Are dreamers considered lawfully present non-qualified aliens?
No.
Regarding transplants, does AEM cover any portion of transplant procedures? If this is so, AEM does cover transplant medications that is life-going. Hopefully I'm stating this correctly.
So AEM doesn't cover transplant procedures. The only thing that AEM will cover regarding transplants is the anti-rejection medication.
So what is the process for classic Medicaid since there's two different processes, there's eligibility determination and then there's the clinical determination. And so the question is, does the information still go into two different systems when all the information is backed together? So maybe somebody could explain what's the classic Medicaid process. So they fax all the information into DSHS and then...
For the classic Medicaid side, for those who are over 65 and over, you would submit your application through Washington Connection and then fax the medical supporting documents, which includes the UBO4 on programs where that's required or emergencies where that's required, to the fax number we provided in the webinar. And then from there, a referral is made by the DSHS financial worker to HCA clinical staff, and they will determine whether or not it's a qualifying emergency. There may be a request for additional information through the provider. It may all be submitted. Once the HCA Clinical Consultant makes their decision, they will then inform the financial worker through our internal referral system whether the application is approved or denied.
What should we do if we have an AEM case pending greater than 6 days?
Email the MAGI AEM inbox.
Can someone explain what a dreamer is?
A dreamer is is more commonly referred to as DACA. It's Deferred Action Childhood Arrivals. These are individuals who are between the ages of, I believe, 16 and 30, or 30, probably 35 or 36 now, who came to the U.S. with their parents prior to the age of 16, and they have been granted what we call Deferred Action Childhood Arrival, DACA, or Dreamer status. For Medicaid purposes, they are treated exactly as those who are undocumented. Even though they do have a status, we would still put them on. They're potentially eligible for AEM if they are not pregnant, a pregnant woman, or if they are over the age of 18 if they are a child. There is another program that they are potentially eligible for, and that is our Medical Care Services Program through DSHS if they should meet the incapacity disability requirement. But for Medicaid purposes only, they are not considered lawfully present, so they are pretty much treated as though they are undocumented, with the exception of the potential eligibility for the Medical Care Services Program.
So regarding the status updates on cases that are more than 45 days. Wouldn't some bills already be to collection by that time, thus making it necessary to submit a status update before 45 days?
I would, we are asking that you don't ask for status updates until this application is more than 45 days old. I cannot imagine any hospital or dialysis or cancer center turning something over to collection within 45 days. Usually it's several months or longer.
Where do you apply for the medical care services program?
Through Washington Connection through DSHS. It would be the, I believe it's the Age Blind Disabled program. And it's called HAND.
There's the Age Blind or Disabled Cash Assistance Program, and then also the Housing and Protection Program. So the Medical Care Services Program would be looked at when you apply for the program through DSHS.
For a cancer or dialysis diagnosis, do we still need to wait 15 days for ASHA to expedite the case, or can we send it to email or call as soon as we have the supporting medical records?
If the client is in need of medical and it's an access to care issue, definitely let us know right away. We'd be happy to expedite those applications.
If a person comes into the ER and goes in for surgery, will they qualify, or does it depend on the type of surgery?
Any client going through the emergency room and it is determined that there needs to be a surgical correction is covered.
I would interject really quick that it does need to meet the criteria of what the agency defines as an emergency medical decision, which is defined in our WAC 182-501-0165.
Is breast reconstruction considered a covered service under AEM?
It is not.
If a pregnant woman is visiting the state just to deliver the baby and is on a visitor visa and is not eligible for Washington Pregnancy Medical, will she be eligible for AEM to cover the delivery?
No.
And that's because she's not a resident of Washington State?
That is correct.
I was told that in order to expedite, the patient has to be inpatient for 30 days. Is that correct?
The only applications that we expedite are cancer, dialysis, or anti-rejection medications for clients with ongoing access to care issues.
And then they're asking, can you please repeat the WAC number one more time?
It's 182-501-0165.
My hospital takes forever to finalize bills or provide me with the UB04. Is there anything else, such as an unfinalized bill, that can be submitted in place of a UB04 so that the application is not held up?
Yes, you can submit an invoice as long as there's a diagnosis code and the REMS code on that form.
What about that we currently have applications pending for more than 60 days? So I'm assuming maybe they're talking about the fact that we've just recently caught up. Can we talk about that a little bit?
At this time, there is still a small backlog. However, it is decreasing daily and should be completely caught up within hopefully the next 3 weeks. So if an application has been pending for more than 60 days, you should be hearing a decision very soon.
If you complete the authorized representative section on one of the applications, does that take place of the separate authorized representative form you shared today?
Yes.
So if you're in WashingtonConnection.org applying for a classic medical AEM, what box do you check regarding to be an AREP? Is there a separate box on Washington Connection?
A screen comes up to identify someone as an authorized representative, and it has the same information request that you would find on a paper application. So if they indicate that there's an authorized representative, they'll pull up the screen asking for additional information on that person.
Is healthcare authorities submitting letters to AREP upon approval and denial?
Yes.
And do denial letters include the reason for the denial?
Yes.
What happens if the patient passes away, but I'm not exactly sure what question I referred to. I wonder if they need, if they have had a designated AREP, maybe you can talk to that real quick.
If a patient passes away, first of all, I'm not sure exactly what your question is, so I'll address it in a couple of different parts. If the patient passes away after the application has been submitted, the AREP designation is no longer valid. At that point, whoever is handling their estate, or if there is no one handling it, then usually the provider will apply for guardianship through the court. I'm not sure exactly how they do that. Lori might be able to address that. But the application is, we still process it as we would. We just, we may be asking for new contact information. Oftentimes, the AREP is the person handling the estate, and if they are, then that would be sufficient if we just go forward with that. But oftentimes it's not, too.
Again, if an applicant has a tourist or student visa, they are not considered Washington State residents. So are you saying that they are or are not eligible for AEM?
We are not saying that a person, an individual with a student or a tourist visa is not a Washington State resident. It is up to the client as to whether they are a resident or not. And they know, what their situation is. If they are a resident, tourists and student visa holders are what we typically call non-qualified immigrants. And they are potentially eligible for children's medical, pregnant women's medical, and of course, if they don't fall into one of those, the Alien Emergency Medical Program. But the visa holder itself does not grant any status as far as being a resident or a non-resident. And it is residency that determines from the point of the student or immigrant or tourist visa whether or not they qualify or potentially eligible for any coverage under Medicaid.
Does an application for an undocumented pregnant woman go through Washington Health Finder?
Yes.
If you're applying for AEM Medical in Washington Connection, would you check the age blind disabled box?
You might.
I would add in the comments that you're applying for AEM Emergent Medical, and I would indicate on the age-blind and disabled box. What you shouldn't do is mark all the boxes because the assignment to the correct place is very, very important. So if there isn't, and I don't know if there's an Alien Emergent Medical box specifically on Washington Connection, but at least put it in the comments that this is what they're applying for.
Yeah, and someone just commented that there is no AEM box, and that's exactly why they were asking. Great. Okay, everyone. Well, thank you for joining us today. You had some really great questions, and we appreciate your input. Again, as we shared, the recorded session as well as the PowerPoint slides will be posted on the Training and Education webpage in about 10 days. So please watch then. And thank you for joining us.